I'm Amber Ware, and I'm a women's health ambassador for the St. Francis Gala. So starting with my women's health journey, I've had 3 deliveries with Jane Dawson, prior care provider here, and the last one being November of 2013. All went wonderfully, but then she retired. Great for her, and I'm done having babies, so then I need to switch providers, and so I come back to St. Francis, SSM, Mosaic, and start treating with Dr. Lorraine Dodson. And our journey together began in about 2020. Was having issues from the prior surgeries and, just abnormal bleeding and pain and just discomfort and just not satisfied. I knew I was done having babies, so I no longer wanted to have these issues. And we met, loved her right off the bat. She reminded me so much of Dr. Dawson, just this calm presence in the room with not okay, here's the plan, this is what we're going to do. It was more of a, what would you like to do? What are your concerns? Here are some options of things, and that included a hysterectomy. There were other medication options to try and alleviate that also. And while the hysterectomy seemed like the end all to that, I wasn't even 40. So the thought of having parts taken out was just not settling. So I just opted out of that and decided to go the medication route. That bought me another year and a half before I finally came back to her. I'm like, I can't, it's time. And she's like, okay. Just like I needed to come to it on my own. And I appreciate that she let me come to that on my own and was willing to try the other things. And so in September, had the hysterectomy. Left my ovaries, which I didn't understand. I was like, let's take it all. Let's eliminate any future surgeries. And she explained the importance of the ovaries for your cardio health, which I had no idea that your ovaries impacted your cardio health. And, just obviously the hormone balance for women, which, I'm only 40, almost 41. And so I've got a ways to go, hopefully, before full-on menopause, and need that hormone balance for myself and my family. And so we did. In September, I came in, and her staff, just wonderful, because I had a million questions. Some I would think of in the office, some afterwards. So I go through our portal and message the nurse, and they get right back to me with an answer. And came in, had the surgery. The surgery staff, phenomenal. I mean, just that calming that morning, with the anesthesiologist, the nurses, prepping for the surgery. And then, I fell asleep and woke up back in my room and was just fine, and the aftercare, and out of here the next day. So my 3rd daughter was diagnosed with leukemia in 2015. And that diagnosis was found here, or at least alerted here with Dr. Simmons back in 2015, and immediately sent us to Children's Mercy. And then we went through several rounds of chemo and then a bone marrow transplant using an umbilical cord as the donor. That failed in July of 2015. And up to that point, I had been handling things pretty okay, given the circumstances. And then when that failed, and the next step was to use my cells to determine whether she could survive this or not, really took its toll. And to admit that there was depression and anxiety happening. So I scheduled an appointment with Dr. Simmons and met with him and explained. He's like, of course you are. Of course you're having anxiety. You've got 2 kids at home and 1 in the hospital with a very serious diagnosis. So we went through the medications and which ones were best suited for me to take, and he knocked it out of the park right there. I've been on the same medication since then, and we've tapered with doses here and then as things lighten up and I get better. And he's like, okay, let's do less. And always very reassuring. Meet with him every 6 months just to check in on that. And my daughter passed away in 2017. And so that brought on, I wouldn't say more depression or anxiety, just different. We had time to prepare. She had battled for 2.5 years. We knew that she was going to succumb to her disease. And so just preparing for that, we were very proactive. I met with Dr. Simmons, I met with Krista Von Barron, and did a little pre-counseling prior to her death of what to expect with 2 other girls at home. And then went into a post-counseling about the week after she passed away. And, we come walking in and Chris is like, I really expected you to be in pajamas and like all distraught. And I'm like, no, I just want to make sure that I'm not going to mess them up. I don't know what it's like to lose a sibling. So I need a guidance for these girls, and how to walk them through losing their sister and myself losing my child. So it's something that I always pray for, is guidance. And that's for caregivers too. I pray for caregivers that are going to not just direct me each appointment, but work with me, sit with me through the appointments, go through the whole gamut of things that may be on the plate that day, and for God to work through them to provide care. And that's what I've always felt with them, all of them. And I told Presley's doctor, I started taking this medication, is that okay? And he's like, absolutely. He says, you have to take care of her, so I need you just as healthy as we're trying to get her. So we talk about, mothers and women just pushing through. There's all the jokes about, men are sick and they're lying on the couch non-functional, but women still are powering through. We have to stop that. If we're sick, we're going to continue to be sick. It is crucial to take care of yourself and acknowledge the things. You need sleep. You need movement. That does not mean that you have to kill yourself at a gym 5 days a week, but get up, get outside. The sunshine and just some fresh air goes a long ways for mental and physical. And just acknowledging, depression and anxiety is not a weakness. Understanding your body, I've been to several appointments where they're like, it's your body. You know what you're feeling. You know the things that you're experiencing. We know them from experience of visiting with other patients, but just that understanding of your own body, and it's okay to do different things in order to take care of that. And then once you do, it just has this ripple effect for your marriage, for your children, and happy mom, happy wife is, that does just ripple down into the family unit.